Good afternoon, everyone. Thanks for joining us today. I hope that you handled the snow well. A little slick roadways this morning. The county's Public Works Department, along with highway crews from throughout all of our 20 towns, 8 villages, and 2 cities, we're out on the roads probably as early as 3 a.m. Some maybe doing some treatment late last night into this morning, but all working hard to clear what averaged to about 2 to 3 inches across the county. Some places saw a little bit more. Obviously, some saw a little bit less. And we are grateful for your patience this morning. Thanks to the department's, the staff, the road snow plowing staff, and those folks working out on our highways. We're very grateful, along with emergency responders, our friends in the tow companies, tow truck companies, and of course our 911 and emergency dispatchers, along with emergency responders. We're very, very grateful for the work that you had to do this morning and do for us always. So I hope you're safe. Let's jump right in. Happy New Year. 5,683 active cases. What we know, of course, is that the Omicron variant is spreading the virus throughout the community. We're also seeing a convergence of several respiratory viruses and the common cold. So you're seeing COVID, likely respiratory viruses, the traditional flu, and what we identify as the common cold. But we are now at 5,683 active COVID cases. The hospitalizations continue to climb, and we certainly don't want anyone in any hospital. But at 147, that is a number that is obviously of concern and does put significant stress on the hospital system throughout the Mid-Hudson Valley. Now, the positive news is that rate of hospitalization significantly less this year than a year ago. So what we know about the particular variant or mutation of the coronavirus or COVID-19 at this point is that it doesn't present itself as severe, and the symptoms you might experience may feel very much like the common cold. But that said, it is more easily transmissible, but not necessarily as severe. But again, 147 hospitalizations are certainly putting stress on the system, and we are obviously encouraging folks to take the appropriate mitigation steps that we know help to slow the spread of any virus, which is most notably vaccinations, wear a mask, and if you're not feeling well, and this is really the most important thing, if you're not feeling well, try to stay in, isolate yourself to a degree so that you don't cause yourself any increased difficulty, and of course don't threaten the health of those you love and those we interact with. The largest number of cases, new cases, have occurred in the 20 to 29 years of age category. I do want to note, if you're following our dashboard today, was a modest decline in total active cases. I forgot to mention that. This is not a trend, but it is likely, listen, it's positive news, but it is not a trend. And so we do expect cases to continue to grow. We saw the increased numbers at the, 2 weeks after Thanksgiving. We saw increases after the Hanukkah holiday, after the Christmas holiday. We might experience a bit of a break, not much, before we start seeing what we expect are cases associated with New Year's Eve celebrations, community interactions, and of course just the transmissibility of this particular variant. But that said, modest downtick, as I said, largest number of new cases occurring in the 20 to 29 years of age category. That's 19% of new cases, followed by those who are 30 to 39 years of age, and that's 17% of new cases. Now, the largest increase in cases, with large increase in cases, New York State has diverted resources away from contact tracing. So contact tracing, not the priority of the state government, and it isn't the priority of local public health departments. So you know the basics, right? If you test positive, we want you to isolate, we want you to protect yourself, and there are steps that you need to take, but including, by the way, communicating with individuals that you may have come into contact with so that they know that they may have been exposed. And it's okay, no one's judging, and well, I shouldn't say that. We shouldn't be judging. There are those who are judging, and you shouldn't be. If you test positive, it's okay. Let's hope that it's not severe. talk to friends and family that you may have come into contact with, and try to keep yourself safe and make sure that they're aware that they should at least be monitoring their health. Now, we continue with targeted contact tracing, but you should not expect to receive a call from a contact tracer from New York State or the county. And that's just a question of both priority and the focus of resources. And I do think after 2 years, we basically know what to do. If you're sick, stay home. If you think you got somebody sick, you should let them know too, and they should monitor their health. So if you test positive, begin isolating as quickly as possible. The current isolation requirements can be found at duchessny.gov/coronavirus. We also, for those who test positive, have a handy QR code when you receive your over-the-counter test and kit, and there will be more available throughout the county in the coming weeks. You'll see on information we provide reference to a QR code that will allow you to simply take a photograph with your handheld device and input that information into the county health department, so that at least you can get the appropriate isolation or quarantine documents that you need, along with the guidance of what steps to take. So let's talk briefly about the changes in the quarantine requirements here in the state of New York. If you test positive, you must isolate for a minimum of 5 days. If you are asymptomatic, you do not have any symptoms at the end of those 5 days, or if the symptoms themselves are resolving, isolation ends. So you quarantine for 5 days. If you feel no longer at the end of those 5 days any symptoms, or the symptoms seem to have resolved or being resolved, you no longer quarantine. And then for the next 5 days, the expectation is that you'd wear a well-fitting mask while around others. If you cannot wear a mask, or you're moderately to severely immunocompromised, you do need to continue that 10-day isolation period. But that said, 5-day isolation, if you're feeling better, you wear a mask, you can return to regular activity, just monitoring the fact that just monitoring whether or not you have those symptoms. Now, quarantine requirements if you were exposed to someone who tests positive changed slightly. If you've completed your vaccination, and then no quarantine is required if you do not have any symptoms. And we'll talk more about that in the coming days and weeks. So no quarantine if you're vaccinated and are not experiencing any symptoms. Please wear a mask and monitor those symptoms for 10 days. And then test at day 5 if possible. And if you develop symptoms, you want to isolate again. So fully vaccinated, come into contact. No need to isolate. However, please wear a mask. Monitor symptoms for 10 days. At day 5, if you can test, take a test. Make sure you're not positive. You want to check. And if you develop any symptoms, you want to begin isolation and go through that process as if you may have contracted the virus. Again, a little complicated, but you can find it at duchessny.gov/coronavirus. If you are unvaccinated, you quarantine for 5 days. So again, if you are eligible for the booster or vaccine, or you haven't gotten your booster shot, or you're not vaccinated, you quarantine for 5 days. You wear a well-fitting mask while around others for an additional 5 days. At day 5, test if possible. No symptoms, continue about your business. Symptoms, you want to isolate. Hope that makes sense. Basically, for 5 days you're isolating. If there aren't any symptoms, with a mask, you're going back to regular activity without any symptoms. That's basically the expectation. duchessny.gov/coronavirus. You can see the new quarantine requirements as outlined by the state. Okay? And we're happy to be of some assistance there. We're averaging now 3,221 tests daily in the last 7 days. I know, we'll talk a little bit about it. I know there's a demand for over-the-counter testing, and we've had challenges nationally throughout the state and locally with the traditional testing sites. However, I do want to say this very, very clearly. Dutchess County was one of the only counties in the region to offer any testing option. Walk in, drive to the Jcpenney's location and get testing. That meant that significant demand with limited capacity. So yes, there were backed up lines, as there were in just about every place in the country, and a little bit of delay. We did experience a chain of custody problem with tests and results one day during the last several weeks. That is being remedied. We expect to continue to enhance the system so that it's a little bit easier and more responsive to your needs. But as the only county even offering that walk-in testing opportunity, community, we felt that having that resource available to residents was a priority. And yes, other counties may do other things, but our focus had been to provide surveillance testing, you the opportunity to know whether or not you had the virus, and then, of course, the ability to keep kids in school through our Test to Stay program, which was the only one in effect in the region dating back to October of this year. So those were the priorities. You're going to see, and I'll talk a little about the over-the-counter testing distribution. You'll see a continuation of that over the coming weeks. But again, we're averaging 3,221 tests per day, over 86,000 tests approved tests were conducted in Dutchess County in the month of December alone. So if you're at home thinking, what the heck are they doing? 86,000 tests provide us, just as if you were doing polling or sampling, provides us the ability to tell you whether or not you have contracted the virus, but also public health policymakers and others. We're able to monitor throughout the community what we think is the spread. And by the way, if you give thousands upon thousands of over-the-counter tests to people, they're not likely to walk through an official health clinic to be tested. What does that mean? That means that in certain cases, the number of tests conducted officially drops. The number of positives may remain the same, if not grow. Positivity rate can increase because of the math equation associated with it. So it's one of the reasons the state and others have gotten away from looking at just one of the data points. But nevertheless, 86,000 tests conducted in Dutchess County in the month of December. And now we do want to note, as I said, the increase of over-the-counter test kits. This particular number will become less and less meaningful. So again, hand out 100,000 test kits, you may decide that you're never going to walk through a clinic, and therefore we may not get a negative test, right? So 100 people walk through a clinic today, about 20 of them will test positive, the other 80 will not. That equates, gives us the positivity rate, right? Total number of tests divided into the total number of positives gives you the positivity rate. If you're withdrawing the negative tests and those that come back negative, you're going to be dropping that denominator, which means that positivity rate will jump, certainly. So we want to monitor tests given, hospitalizations, total cases per 100,000, total new cases a day. Positivity rate becomes a less and less meaningful number when you and I have more access to over-the-counter tests and not necessarily going through that formal process of testing through a health department clinic. I know that's a lot of information. I hope it was somewhat clear to understand. But again, if you're self-reporting, these data points on the dashboard become less and less meaningful. It's just important to understand that. If you're, just like any other day, you decide you have the cold, you're not reporting to somebody you have the cold. You report to somebody you have the cold, gives us some data that we can share with the public. If everyone's doing that, we can monitor activity. The fact is that's going to happen less and less, in which case these data points become less and less important, less and less meaningful because they are less and less accurate, which I think is important to understand. We're averaging 728 new cases daily. The 7-day positivity rate is 22.4%. And again, this is a rate we will no longer be reporting again. So understand, the positivity rate is not necessarily something that's going to be terribly helpful because we're withdrawing a good number of negatives from the system because you take home tests, you take testing at home not being included. So again, with the increased volume in case counts and the huge growth in the testing, many negative cases are no longer being entered, and negative over-the-counter tests are not being reported at all. So we're only going to be seeing positive cases that are reported. And so the positivity rate becomes absolutely meaningless. And as an example, I think Ulster County last week had like a 30 or 40% positivity rate. That doesn't mean that they have actually a 40% transmissibility rate. What they had was a massive reduction in the total number of negative tests being reported in their system. So the dashboard becomes, and this data point becomes meaningless. Sadly, 543 individuals have lost their lives to this virus. And again, we encourage you to use those mitigation steps, including wearing masks, vaccination, isolation, monitoring your own health in order, personal hygiene, and staying in if you're not feeling well. Along with this, Dr. Santiago noted in her alert last week, there are steps that you should be taking to stay healthy. So consider those choices that we make in our own lives, right? If we do a little more exercise, a little more vitamin D, a little more vitamin C, a little more sunlight, all of that plays into our overall individual health, which extends to our public health, and therefore they're all steps that we can be taking to minimize the impacts of this particular virus and all the other ones that are circulating throughout the community and society. To talk a little bit about hospitalizations, 14-day average, we're seeing 83 patients on average. 62% of those individuals are either partially or not vaccinated at all. Again, not judgment, just offering the data point, with about 38% of those individuals hospitalized being fully vaccinated. That number has ticked up a little bit, but we've been hovering between 70 and about 70% on average had been our not vaccinated to vaccinated within the hospitalization. That number has shifted slightly. 62% of those hospitalized not being fully vaccinated or not vaccinated at all, with 38% being fully vaccinated. And the age breakdowns as follows: 0.6% are birth to 18 years of age. 15% of those hospitalized are between 19 and 44 years of age. 27.9% are those 45 to 64, and 56.5% of those individuals hospitalized are ages 65 years or older. Vaccination, we are now at 83.2% of adults in Dutchess County have received at least one of their vaccine doses, with 73% of our total population having received at least one dose. Now, the highest vaccination rates are among those 55 years of age or older, and that ranges from 90 to 99% of those population, those age categories having chosen to receive their vaccination. Those who are 5 to 11 years of age, parents making that decision, 27.1%. The state average is 30. And those 12 to 17 years of age, 66%. The state average is 73%. Now, booster eligibility has expanded, along with recommendations that more residents get their boosters for increased protection. So you want to check to make sure that you are eligible, but those eligibility requirements or eligibility standards have been expanded, and we continue to offer vaccine options and clinic opportunities at the Jcpenney's location, the Poughkeepsie Galleria. That's every Thursday and Saturday. We are expanding these hours, so every Thursday and Saturday with expanded hours, and beginning next week, we'll be expanding Tuesdays 1 to 4 p.m. So every Thursday and Saturday with longer hours of operation, and expanding to Tuesdays 1 to 4 p.m. Appointments are recommended, although we do accept walk-in, but we encourage you to pre-register and to remember to bring that vaccine card so they can update that information for you. We're expanding availability of the year after this new year began to meet growing demand for boosters, so keep an eye out at dutchessny.gov/COVID vaccine for more information. But there'll be more outreach, more opportunities for vaccination both at this location and at other locations throughout the county. So keep an eye out for that as well. So testing at the Jcpenney's location at the Poughkeepsie Galleria. Mentioned a little bit of that already, but again, upstairs. So if you're coming to test, you need a test at the Jcpenney's location at the Poughkeepsie Galleria. You want to enter on the second floor nearest Best Buy. Now we have expanded hours and increased capacity to meet that demand. We are now open 5 days a week. We want to thank Governor Kathy Hochul in the state of New York for providing those additional resources. We expanded our service. The state also augmented our testing sites so that we are now fully 5 days a week, Tuesday through Friday, 1 to 7 p.m. So every Tuesday through Friday, 1 p.m. to 7 p.m. We are now Saturdays from 9 a.m. to 1 p.m. as well. Over-the-counter test kits. We have distributed over 36,000 test kits to school districts over the holiday weekend. I do want to thank the Dutchess County Department of Emergency Response, the staff at the Department of Behavioral and Community Health, and our Medical Reserve Corps volunteers for assisting in this distribution effort. Now, we've been conducting Test to Stay since late October of this year. The state finally embraced Test to Stay and is now making available test kits. We distributed, as I said, 36,000 test kits to school districts across the county, and the vast majority of these kits have already been handed out to families countywide. The latest shipment of kits for public distribution were provided to municipalities earlier this week. Our process is we receive this distribution from the state. We're hoping it's more regular with a degree of consistency. We're not seeing that yet, but we're hoping weekly we get the same basic number. We distribute those from the state to municipalities for distribution. It is allotted based on population. So what that means, of course, is we take that number divided out by the number of residents in each of the communities and distribute those test kits based on each municipality's population. If you live in a village, you are a village resident. So if you live in Tivoli, New York, you may also be a Town of Red Hook resident. However, for the purposes of test kit distribution, you would go to the Village of Tivoli location. And we encourage you to visit your local municipality's websites for information. Keeping in mind that there's a demand for these test kits. So in certain, first of all, that means allotments go through very quickly and are distributed very quickly, but also keep an eye out for traffic and lines, etc. You want to be a little bit aware of that as you're traveling in and around those distribution points. But take a look for your municipality's distribution at their website or by contacting your town, village, or city hall. I do want to thank the supervisors and mayors across Dutchess County, Republican, Democrat, Northern, Southern, and Central, and Eastern Dutchess, all engaged in trying to be effective in distribution of those test kits. So, we do expect that the numbers will continue to expand. We do expect a degree of consistency. Dutchess County, and we'll continue to update you in the coming days and weeks. But look for a weekly distribution and allotment through those municipal points with the expectation that soon the county will also be providing broader access to test kits. We'll keep you posted on that. Thanks to an allotment secured by the state of New York, Dutchess distributed over 100,000 KN95 masks. This was provided by the state. We distributed them to businesses, community organizations, faith-based organizations, along with municipalities during the week between Christmas and New Year. It was a significant effort. We're very, very grateful to our partners, including many in the business community who assisted in distributing that PPE. And so with that, we encourage you to continue to follow us on Facebook for regular updates. Follow us at duchessny.gov. If you have any additional questions, feel free to share them with us. But again, as we've said, we just want you to be safe, assess risk in your life, make smart choices to protect your health and the health of those you love. And in the meantime, stay strong, keep healthy, and be kind, please, to each other.